my patients present to see me because they're having difficulty breathing out of their nose. Difficulty breathing can be a result of a deviated septum, which is the bone and cartilage wall between the two sides of the nose being crooked. It can be a result of polyps, or it can be a result of swollen soft tissues inside the nose, which are normal tissues that help humidify and moisturize the air that we breathe, called the turbinates. And there are 3 turbinates on each side of our nose. There are these finger-like structures that hang down from the side wall of the nose like little shelves. And in a lot of our patients, those turbinates are swollen, whether it be from allergy or they just have swollen turbinates for reasons we're not really sure of. Nasal sprays, decongestants, other kinds of sinus and allergy medications can do a nice job to help people with their stuffiness, but there's a fair number of patients who don't get relief. And the next question is, well, what else can we do? And in the past, we would have to take our patients to the operating room in the hospital, put them under anesthesia, and do a procedure where we would reduce or even remove the turbinates. Now, in recent years, a minimally invasive office procedure that takes 20 minutes to do in the office, called a VivAer, which is spelled VIVAER, nasal remodeling procedure, has been developed. And in this procedure, in the office, I'm able to remodel and sculpt those soft tissues, those turbinates, down to a size where people can breathe better. It just requires a little bit of local anesthesia in the office. The procedure takes 20 minutes. We're not removing any bone, we're not removing any tissue. The device works at a low temperature, so we're not creating heat when we do this procedure to reduce the turbinates and remodel them so that the airways can be improved. My patients are going back to their normal activities the day after the procedure. We manage them with some saltwater irrigation. They come back to the office in a week or 2. We do a gentle cleaning of any crusting or debris that forms inside the nose, and that's really about it. My results have been excellent. My patients have been followed for at least 2 years in many cases, and the results that they've had during that first period of time with improvement in their nasal breathing is the same 2 years later. And my patients have been very, very happy with it. And this is a procedure that's covered by insurance and has been very, very well tolerated by my patients, and they're very happy.